First aid for metatarsalgia, which is pain in the ball of the foot. Information in this video is not meant to replace medical information from a professional. It's just meant to keep you going till you can get to your doctor's appointment. So there are three most likely causes of pain in the ball of the foot. One is you bruise the bottom of your foot, often called a stone bruise. The second is Morton's neuroma, where a nerve can get impinged or caught between the bones and the ligament and tendons in the ball of your foot. Third possibility is you may have broken one of your toes. So, first scenario, you bruise the bottom of your foot. It usually occurs from a sudden impact or from wearing shoes that are too hard. Best thing you can do is rest, ice elevation, and possibly compression, which I'm going to cover at the end. And you need to start wearing good quality tennis shoes, not those hard shoes that created the bruise. Second possibility, Morton's neuroma, the nerve that is caught, and it feels like a burning sensation, usually triggered. You kind of heard it wrong. It hurts for a while, it goes away, it comes back. Unfortunately, it's a chronic condition and it's not going to just heal, so you do need to see a doctor. In the meantime, you can try getting some thick moleskin. You're going to cut a rectangle hole. Say it seems to hurt about here where the sticker is. Stick the moleskin on so that the pain is kind of centered within the hole there, and hopefully that will lift some of the weight off the area that hurts. Third possibility, you suspect that you may possibly have broken a toe. What you need to do is called buddy taping. I recommend getting some masking tape, trying it on a little place on your skin to see if you're allergic to the adhesive. Then you're going to rip strips. I like to go around the toe that hurts, trying to move it as little as possible, because if you suspect that a bone is broken, moving it is going to make the injury worse. After you go around the toe that hurts, you're going to go around again and tape it to the next toe, like so. Also, compression. You're going to need semi-rigid arch support. The soft insoles are not going to do enough for you. And it just goes on the bottom of your foot and Velcros on. This insole here may fit in your hip hop shoes, but probably is not going to fit in any of your other dance shoes. So I've discovered that you can use masking tape. And for doing this, I like to leave the masking tape on the roll. I'm going to put it on this foot. You simply go around and around and around. And say the area hurts up here, you're going to stop just before the area that hurts. Cafe Taster, Cafe & Company, and AMT Productions are not liable for any injuries occurred from using information in this video. And again, this is just first aid to keep you going till you can get to your doctor's visit. Hope you feel better soon. Take care. Bye.